Good morning, ladies and gentlemen. In the next few minutes, I would like to introduce you to my research topic on the theme of COVID-19 associated multisystem inflammatory syndrome in children. My name is Adrienn Lukács, and I'm a junior investigator in the program of Translational medicine. I'm a physiotherapist, and during the next years, my mission is going to be to improve the pediatric physiotherapeutic care, focusing on the MISC children. To reach this goal with my researches, I would like to provide scientific and profession-specific information because currently in the field of physiotherapy, we are lack of evidence-based information and we need those therapies which can be disease-focused. Just for a short overview, to assess these problems, we are conducting 3 different studies, focusing on the main aspects of the multisystem inflammatory syndrome. As a first step, we would like to investigate the prevalence and the characteristics of cardiovascular abnormalities caused by MISC. 3 to 6 weeks after the COVID-19 infection, children can develop a multisystem inflammatory syndrome. For a million SARS-CoV-2 infections, its incidence is about 300. One of the main problems with this disease is that more than 75% of these children will experience some kind of cardiovascular problem during their disease course. Luckily, these changes usually in most cases normalize at discharge, but sometimes they can remain and become long-term morbidities. These changes can be, for example, echocardiographic changes or anatomy abnormalities like aorta dilatation. As a physiotherapist, it is really important to know if a patient has any cardiovascular problem or not, because it will influence the whole rehabilitation process. That's the reason why we think it is really important to assess the prevalence of these cardiovascular changes. We are looking for those children and adolescents who are under the age of 21. Knowing this information, we can provide physiotherapeutic methods. For example, monitoring the cardiovascular status of the children can help to maintain a good status and also to be an essential and more effective part of our treatment. We conducted a systematic literature search with the search key, and we got about 2,000 records after the duplication elimination. We are now at the full text selection phase. Connecting to the MISC, our next planned study would be an international multi-center survey about the inpatient and outpatient physiotherapy. As I mentioned, MISC is a very new and unknown disease. There are similarities with Kawasaki disease and also with macrophage activation syndrome, but now we are currently in the phase of uncertainty. And that's the reason why we would like to provide an expert opinion on this topic. And also our goal is to find the similarities and discrepancies among the national and international hospitals to provide objective data to physiotherapists, what the others do and why. The method would be a self-developed questionnaire based on the current information of COVID-19, MISC, and Kawasaki disease, focusing on the experience level of the PTs and also the use techniques and methods. The last and third study would be an assessment of those children who are 1 year after the acute inflammation and who are coming back to a general check-up to the hospital. The other big problem with the multisystem inflammatory syndrome is that more than 60% of these children need an intensive care unit admission. And we can say that it is a burden for the child, for the family, and also for the healthcare system. Imagine that you have high fever, your joints and muscles are in pain, you are weak, you barely have enough power to go to the bathroom. And on the top of this, it's experienced by children. And in most cases, they are bedridden and also sometimes they need ventilation. That's the reason why we would like to assess these children's current physiotherapeutic status to provide information about the changes over the time. We hypothesize that these children will perform weaker in the physical tests. You can ask, why is this study so important? And I will tell you, because I can tell you that what to expect 12 months after the multisystem inflammatory syndrome among children. For example, if I say that in most cases these children performing well, they are doing well, or these children, we have to be aware of very big pulse and oxygen saturation level changes during the physical load. It is a really big difference in one outcome. We would like to conduct a one-time physiotherapy assessment focusing on the muscular strength, also on the balance and on the physical performance. And just for a short overview, with the results of these studies, we can comprehensively assess when and how can a physiotherapist help these children. That's the reason why we would like to conduct all of these studies. And the man who moves a mountain begins by carrying away small stones. With my work, I would like to provide scientific data on certain topics to reach an evidence-based and improved pediatric physiotherapy in the end of my journey.
After doing the literature search, what are the most frequently investigated cardiovascular outcomes in these studies? So what are the main changes, cardiovascular changes?
During my searches, I found out that in laboratory parameters, the D-dimer and also the pro-BNP levels elevated, and radiography changes, the pericardial effusion was one of the biggest number, and also the myocarditis was the prevalent one.
I would like to ask about the second topic, because it was visible for a brief time that you, in your questionnaire, plan to include the Kawasaki disease. And I would like to ask why and why the Kawasaki disease. I know that there are similar cases, but I would like to know why you chose the Kawasaki disease especially.
Mainly based on its similarities, which can be predictable with the Kawasaki disease and also the macrophage activation syndrome. Currently, we don't really know anything about the multisystem inflammatory syndrome, and this disease is one of the closest one to it. And we have relevant data from it, so that's the reason why we would like to use those informations.
I'm asking about your last topic, about the controls. Yeah. Because in research, I mean in most research, in human research, but even in animal research or even in cell cultures, I mean the most difficult part is to find the right control. So how do you recreate the controls? Second, we didn't see, I mean, because that was just fast, because you wanted to save our time. So we didn't see what kind of test do you do. Are there any of this which is invasive? And is there a difficulty about that? Okay, so then talk about the recruitment.
All of these tests are non-invasive. For example, maximal breath holding time, or 3-minute step test, or the 6-minute walking test. We are looking for specific changes in their pulse or in their oxygen saturation level. And we are looking for that, how can they perform physical tests after the disease, and then we would like to compare these results to the general population. We hypothesize that these test results will be weaker, but in the other hand, maybe we get that after a year they are performing well and nothing happened. It can be also, and this will be informative. It will be a school, and we will age and sex match them.